Josh, today in Rounds, we had an amazing conversation on setting patient expectations. What were some of the better takeaways, I think, that you brought to the presentation?
I think having that open and direct communication with patients that's two-way, right? So first trying to find out what their expectations, what their predictions, desires are related to their clinic visit, their physical therapy visit, or their surgical outcome. And then also kind of sharing, well, how can we achieve that? And if it's perhaps needing a little bit of adjustment to bring it into line with what's possible, being open about that.
I love the point that you brought up. You said sometimes patients feel like you have this magic drawer that they can just come in with all of the different options and you'll just, pull something out. Is it an injection or what is it they're looking for from you?
Sometimes it is. And so in the case of physical therapy, when I'm referring patients off for that, I'll explain it's a lot of hard work. And the reality is that's how you're going to get better. You've been deconditioned. We're going to do this surgery that's going to give you the ability to function again, but you're going to have to put in a lot of work in the terms of physical therapy. And it's like, oh, isn't there an easier way? And unfortunately, there's not.
I love that. I love just how you laid out how difficult it is sometimes to find the right solution for the right patient. I think we've talked about that in Rounds before, where it's the right solution for the right patient to get the right outcome. And at times, patients have this expectation that I'm just going to go and you're going to solve it, and or maybe it's a one and done. And I love that you explained with your contact with patients, sometimes there's a second and a third follow-up. I think switching gears, I loved the explanation that you made. I really appreciated where you said, I have these menu of options. Could you talk about how you do that?
Yeah. So for most of the conditions that come in through the office, patients are dealing with some kind of a chronic pain. Occasionally it's acute. And once we have worked together to identify that, we've reviewed the imaging, discussed their symptoms, done the physical assessment, then we say these are the treatment options that are applicable. And even though I work in a neurosurgery office, every single time a patient comes in, my goal is only to do surgery if it's absolutely necessary. Sometimes patients will want to skip over things like physical therapy, injections, just giving it time. And my advice is to them, don't skip these other things. Surgery is an important tool for treating medical conditions, but it is not, generally speaking, the first stop. And I think that helps a lot of patients kind of take a break, relax, and address some of their anxiety. Some patients, they do want to skip kind of to the end for whatever reasons, and it provides an opportunity to discuss how that's generally not appropriate.
So as a new patient coming into your clinic, right? So let's say as a new patient comes to your clinic, what would be the way that you would set the stage for this, set the table, I think that we talked about, for this kind of perfect patient experience so that they could have their expectations met and then understand their total course of care?
Well, some of it's going to have to occur before I even meet the patient. Hopefully, the office has in place a really clear set of expectations about when to arrive, what's going to occur from the moment they walk into the door to when I come into the room to meet them, and that they feel prepared to discuss their different concerns. I've previously stated that I think it's beneficial for patients to come prepared with questions. Sometimes people come in with a list, and while occasionally as a provider you might say, oh, that's going to be difficult for us to get through all of those different items on your list, at least it indicates that the patient is committed, right, to getting better, and it also clarifies what you're even discussing. Now, you may not be able to get through everything in that initial appointment, but you can address that saying, hey, which of these things on your list is what you would like to discuss today? And then we can make arrangements for addressing these at a future visit.
Yeah, I love that. Your magic potion. We sometimes call it a magic wand in the physical therapy world. People come in with lots of different body parts and they just like, have a magic wand. This is the one thing I can fix. Okay. Of all the cases that we discussed today in Rounds, how do you think any patient coming to see you in your office can have the best outcome in their care?
Well, I'm going to define outcome not only from the clinical sense, right, but also in their emotional satisfaction. And so some of the value in asking people and setting expectations in the beginning is that you can, throughout your interactions with the patient, follow-ups, and perhaps in the last time you see the patient, kind of refer back, hey, how did we do? Did we meet your expectations? What things still need to be done in order to get there? And that, I think, helps address that concern from the patient. Yeah, hey, my knee is better after the surgery, or I have improved strength in my arms after doing physical therapy. But I also felt like I was appreciated and heard, and that makes me feel like we didn't leave anything unsaid, right? The drawer of magic potions, we explored whatever there was, and so I know I've gotten the best outcome that's possible.
Yeah, and I love that, and grateful for your presentation today. I think that in the healthcare world, you elucidated in a study that 62% of people have negative reactions or a negative connotation when it comes to their healthcare provider. And I love the fact that as we come together, many minds, we're trying to change that perception. We're trying to create an opportunity for patients to have a much better experience throughout the healthcare continuum. So thanks for that today.
Absolutely appreciate it.